Young adult get unstuck. We sometimes call this failure to launch. As I was preparing for this talk, I saw this article in the Wall Street Journal, and I wanted to share it because I'm not an anthropologist, but our young people are living in a certain time and culture, and it impacts how they think about themselves, their goals, and their future. Of course.
Can you keep going with the podium for now?
Okay. Technology always fails me, I have to say. It's very disappointing. I just touch it and it just breaks. Well, what I know as a child psychiatrist is that as parents, we have children. We give over a few decades of our life and identity to raise them. If all goes according to plan, they leave, they launch. In my opinion, it's just when they start to become helpful in the kitchen, actually. And that's the good outcome. Failure to launch is worse. As much as it is hard to let our children go, when children have difficulty leaving and they get stuck, they feel like failures and their parents are left feeling baffled and upset. I had a patient, oops, where is there? Yep. I'll tell you the quote, it was supposed to be right here. But Jimmy, 22, his parents came to see me and with him, and they said, oh, all of our friends are talking about their kids' accomplishments, education, relationships, careers, but we don't have anything to say. Our Jimmy's not doing any of those things. The poor guy had finished college, but he was now home a full year, living back in his childhood bedroom, no job, no vision for the future. Well, so what was going on? His father said to me, shouldn't all children just be able and ready and willing to just launch at age 18? Shouldn't at age 22, all children just be ready for a job after they finish college? Well, the answer is no, that milestones happen at different times. We are so attuned to these early milestones, like up to age 5. We obsess about them when we have little kids. Are they walking? Are they talking? But we don't think so much about these adult milestones, but they need to be achieved in the same way. So Dr. Erik Erikson, famous psychologist, in 1950, described these psychosocial stages of development and included this early adulthood and adolescence leading up to early adulthood. So it's not a novel concept that there's adult milestones, but it's really not something that we think about that much. Please ignore that he calls old age 65 and older. So here are some of these adult milestones that you might think about, and we could probably add a whole bunch more: learning how to drive a car, having your own bank account, managing a checkbook. But for a second, let's talk about parents. Well, I guess really talk about myself. These milestones are our milestones, right? So I can control a lot of what I do in life. I got an education, I got married, I had kids, I have a career. But launching my children, having grandchildren, success in college, I can't control any of those things. My good friend, when her daughter got into college, sent a message to all of us. It was, I got into college again. And I understood what she was talking about. The child's milestone feels like her milestone. But the point is, when our children get stuck, it affects us. We feel stuck. We're stuck too. The Wall Street Journal talked about adulting. So this is a verb now, to be an adult. You're adulting. And a lot of kids will say to me, I'm so nervous, I'm not sure I can do this adulting thing. Well, the economics of the current situation for people is complicated, as the Wall Street Journal points out. Young people are graduating with a tremendous amount of financial debt. A college degree doesn't necessarily get you a job. Interest rates are high, houses are difficult to come by, but this is impacting all of these young people. Also, there's less pressure to conform or settle. Like we just march through, at least I did, march through these milestones. A lot of people in earlier generations did. What do? You get married, you get a house. Kids today don't feel like they have to do that. And so more choice means difficult choices. Some of these individuals, too, also have these outsized dreams. They don't want to start a house. They want to start it with a big house, so they don't get any house. So is a kid a failure if they haven't launched by the time they're 20? The life expectancy in the United States has changed dramatically. So in the past 150 years, just about doubled. The word adolescent didn't even exist until the turn of the previous century when we took kids out of factories and they didn't have to work there anymore. Things have really changed dramatically. So the average age of buying a house used to be late 20s, now it's late 30s. Marriage, early 20s, now it's late 20s. Children being born to women over the age of 30, that's increased fourfold since the 70s, perhaps. New mother at age 40, not that unusual anymore. So with longer life, there's also a sense of spreading out some of these different milestones. And the children now, they're all fall into one of these categories. I actually had to write them all down because I can never really remember what an X or a Y or a Z are supposed to be. But the baby boomers, they believed in the American dream, and they were very hard workers. Then they had these kids. The Gen Xers said, they're working too hard. I want a work-life balance. The millennials, they're like the trophy generation. They got a trophy just for showing up. They expect to be praised quite a bit. We protected their self-esteem. These Zoomers, they did a lot of their school virtually on Zoom during the pandemic. So they're a very different kind of experience that they've had. And then the youngest kids now, there's digital natives, right? They spend 3+ hours on screens from infancy. You'll see like little tiny babies, really, and kids with holding screens in front of them. The milieu that these different groups have grown up in changes who they are and what their expectations are. Like when I finished paying tuition for my millennial daughter, I said to a friend, I've just paid my last tuition check. And she said, yeah, but now you got the young adult stipend to worry about. I said, what in the world? And it's a word for it. So yeah, kids are expecting some financial support because they want that nicer apartment, not the one that they can actually afford, right? So here's my patient parent. So, are they really a failure? Well, Matthew McConaughey's making failure to launch look pretty good here, right? And it's become like such a kind of cultural phenomenon in a way. There's a whole genre of these movies, and mostly it's a kind of a beautiful, organized, smart woman who saves the irresponsible hermit guy from his quiet, isolated existence. In real life, there's no Sarah Jessica Parkers. These are just really smart, organized moms who are motivating and trying to motivate their kids to get going. There's even this whole new word that's developed to define individuals who are in between this adulthood and adolescence. Adultolescent, adolescent. These are 20 and 30-year-olds who aren't teenagers, but don't really feel or act like adults yet. It's a kind of a group. My good colleague, who's Japanese, her mother, a child psychiatrist, is doing work in Japan on a group of individuals that are called the Hikikomoro. I hope I've said that correctly. But they've been studying them in Japan since the 70s, and these are young people, usually male, who are living at home, and no job, no training, no employment of any sort, no relationships. About 1% of the population lives like this. Is that a mental illness? There's dozens of papers suggesting, I don't know, maybe it's more of a society syndrome that we have to understand, something about our modern society. Well, speaking of, let's see if this will work, cultural changes. Nope. Anyway, he says, hello, my name is George. I do not have a job, and I live with my parents. He's still able to get this lovely woman to pay attention to him, even though he's living like one of the hikikomori people. Well, what about the pandemic? Isn't COVID to blame for so many things, and don't we worry about its impact on everybody, and especially our children? The pandemic with the stay-at-home orders really did involve our children of that age taking a few steps back in their development. Kids who had launched off to college, back in their childhood bedrooms. Romantic relationships, gone. Social distancing, unless they were very motivated, they found their relationships anyway, I think. But mostly kids were isolated at home again, like living like younger children. Job offers that they had had were rescinded. So many different things just shut down entirely. So they were really quite backwards. It looked a little like a failure to launch epidemic of all of these kids at home. And the pandemic affected everybody psychologically, tremendous amount of distress for all of us, right? But there was this study that was really impacted me about levels of distress during the pandemic. And the highest level of distress was experienced, maybe it's no big surprise, among the individuals who were between like 18 and 29. And my 24-year-old son at the time, I said, oh my gosh, you're in this group experiencing the most psychological distress from this distressing event. And he said, well, yeah, of course I've got more distress than you do. I have a life that got interrupted. And I wanted to say, I got a life too, ouch, but I realized he had his major milestone time right then and there. That was not only, it was stalled and backwards, back home in his bedroom. Well, smartphones, video games, maybe you gotta add AI to this, are they to blame for some of the problems that we're facing? Well, this author suggests that the smartphone that became available to young people around 2010 was coincident with a dramatic increase in rates of depression, anxiety, suicide, self-harm, and makes an argument that childhood is not childhood anymore because kids are getting phones to look at. They're not interacting with people, they're interacting through their phone. After hearing Dr. Perla's talk, though, I guess the good news is they'll be able to use these AI therapists who aren't real people, and maybe that will work to great advantage. I don't know. But the recommendation from this fellow is we have to really pay attention to what we're exposing our children to, not only in terms of content, but just this constant, it's like giving crack cocaine to someone. They just can't get rid of their phone. So, well, failure to launch, difficulty getting stuck as a young adult. This is not a problem that was caused by the pandemic or by cell phones. There have been common times for children to display some failure to move on. Often happens at high school graduation, onto college, during college, complete needing leave of absence, or even after college graduation, like my young patient, Jimmy, age 22, who's back home again. So his parents described to me that he was like a prodigy on the piano. He's a brilliant kid. They're so baffled by what was going on with him. And his high school grades were so-so, but he was at piano competitions all the time. He had friends, but he was also very focused with all of his activities. They sent him off to college, a big football school in the Midwest. It wasn't his first choice, but that's where he went and majored in computer science. They watched as he kind of continued along, passing his classes as far as they knew. He graduated computer science, GPA 2.7. So it was astounding to them when they learned that, but he did graduate with his degree, and he didn't go on to get a job. They saw all of these symptoms in him. He was passive. His motivation seemed so low. He was procrastinating. He'd get upset when kind of small things didn't go his way. Should we just kick him out? Tough love? This is what his dad said to me. Is he just being lazy? It looks kind of like lazy or spoiled or selfish, entitled behavior. But what I explained and what we know is that many times for these individuals, significant mental health struggles are playing a role in their stuckedness. So what can we do as clinicians? I'm not an anthropologist, I can't change the distribution of smartphones, but we see these kids and we treat what we can treat. So you picture a bird stuck in a net. We remove the obstacles, remove the net, and then let's see what this bird can do. So for this young man, Jimmy, these, by the way, in our transitional age youth clinic at Mass General, these are kind of the top diagnoses that we end up seeing in these young people. There's others too. I mean, this is an age that's kind of early adult years, is a common age for the onset, unfortunately, of very serious mental illness, psychotic disorders, schizophrenia, bipolar disorder. Just when you send your children off to some place where nobody knows them at all, they may start to develop these problems, and sometimes there's a delay to treatment because nobody recognizes it until they just finally have failed all their first-term classes. But these are kids who don't look so ill. So the parents were confused by it. And I got to say, Jimmy himself couldn't really explain to me what was going on. But he was calling himself an introvert. His parents did too. As I talked to him, I realized he has autism spectrum disorder. So autism spectrum disorder is, it's not a lack of interest in social interactions. It's not a lack of skills socially, but it's an impairment in that area. And he was a guy who grew up in a community. He had friends. Well, I asked him about these friends. Where'd they go to college? I don't know, he said. When was the last time you talked to them? Oh, in high school at graduation. They were not really friends. These were like guys he grew up with who did a kind of parallel hanging out. So when he got to college, people were talking a language of social interaction that he didn't have and he didn't understand. It started to make him feel self-conscious and bad about himself. Anxiety set in. He stayed in his room. This is 4 years. We discovered he stayed in his room almost constantly. His whole schedules were upended. His GPA was not good. You can see that he did the bare minimum of work. And he was depressed. He was depressed in high school, it turned out. His piano, he felt so pressured by his parents. It was something he did well, but he couldn't love it. And they were also surprised about ADHD. So they never thought he had ADHD. He always did well in school up until middle school and high school. He was never disruptive, no hyperactivity. But he described, check, 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 all of these symptoms associated: easy distractibility, inattention, losing things, disorganization. He had tremendous difficulty starting and completing any work that required mental effort. And when he was younger, because he has an obviously high IQ, he was still able to get reasonable grades and move along, and even get through college. But it was a tremendous burden and obstacle to his really being successful in using his brain power. Executive functioning deficits is not ADHD. It doesn't respond to the medications. It's a cognitive set. Maybe half people with ADHD have this problem, that they can't fathom the sweep of time. They don't keep a calendar. It doesn't come naturally to them to think about how to organize their life and their day. So these are all of these obstacles and burdens that he had. We did what we did. We cleaned it up and talked to him. He became more self-aware. We started an antidepressant medication. He started an ADHD medication. I mean, these things aren't miracles, but we're taking away some straws off the camel's back. He started to become interested in putting in job applications. He got accepted to a 12-week computer science coding boot camp because he realized he didn't have all of the computer skills to actually get the job he wants. They put him in a place. He's got a job. He's in California. Is he the kid that his parents want? Well, I think his parents thought that he was some combination of Bill Gates and Bill Clinton, and that he'd be like, have lots of friends and a great life. And, the dad would say, is he ever really going to be normal? And, what does that mean? Normal means that they do everything that the dad did at the same time, and maybe even better. No, so a lot of the work, too, had to do with not only Jimmy, but his parents changing their expectation, letting go of what their dream child was or what they thought he could or should be. I was treating a young man who, back in Boston, Harvard family. Everyone went to Harvard, undergrad, Harvard, graduate schools, medical schools, et cetera. Poor boy in this family at age 15 had developed bipolar disorder. Dramatically derailed the poor guy. And he was treated, he did better. Took him 6 years to get through 4 years of high school, 6 years to get through 4 years of college. As I would work with his parents, especially his dad, he kept kind of clinging to this idea of the boy he used to have. And at one point he finally came to me, the dad, and he said, I think I'm getting a sense of what you're saying about his different trajectory, his different way of living and leading his life. He's not going to go to Harvard like the rest of the family did. But do you think he might go to Dartmouth? So, still work to be done. And Jimmy's parents, too, started to accept the boy they had in front of him. He lived on his own. He was financially independent. He had a roommate. Did he have a romantic relationship? No. Did he have a lot of friends? No. Did he show up for work every day? Yes. Was he enjoying things? He enjoyed his video game. All of those things were there. They were all quite positive. I don't think this little clip is going to work, but I will tell you there's a movie called A Real Pain, and it involves a really somewhat likable failure to thrive young man. So in this clip, oh, there we go. Let's watch it.
Yes, in fact, she used to tell me that, like, first-generation immigrants work some, like, menial jobs. They drive cabs, they deliver food. Second generation, they go to good schools, and they become, like, a doctor or a lawyer or whatever. And the third generation lives in their mother's basement and smokes pot all day. I mean, I think she was, like, just speaking generally about, like, the immigrant experience.
I lived in my mom's basement.
She was just talking about immigrants.
Okay.
That's all.
Yeah.
So failure to thrive, I mean, a likable young man, but he needs some adulting. So thank you for your time and attention.